Welcome back, everyone. This is part two of my conversation with Dr. Stephen Feit. If you haven't listened to part one yet, go back after this episode because we covered the foundation of malpractice prevention and why protecting your license really begins with protecting your patient, right? So today we're going to dive deeper into the gray area, that space between clinical judgment and technology, and how AI can actually help us make more defensible, data-backed decisions without losing the human element in dentistry. Dr. Feit, last time you mentioned how most malpractice cases stem not from a single mistake, but from a breakdown in systems. So let's talk about how AI can help prevent that.
Yeah, so with AI, the beautiful thing is most dentists, even if they're in a group setting, are pretty much solo because if I want to talk with a colleague of mine who's in the next treatment room, they're very busy doing whatever they're doing, and they may not be able to take a break to collaborate and put our heads together to figure things out. So the beautiful thing about the AI is that it's readily available at any time, anywhere, and the clinician can just take pause, right? Back away from the patient, just consult with AI, and what a brilliant second opinion. I mean, it's a massive second opinion. So it really can put, there's an old saying, as they say, slow down to go fast, right? You
Mm-hmm.
just because when you go fast, you lose your fine motor skills. You start dropping things. You don't follow checklists and systems and
Mm-hmm.
protocols. So sometimes you just have to take a quick break, slow down, get some information, and what's so terrible to share that with the patient? Hey, I was at a crossroads here, and I just wanted, Dr. Peter Dawson always used the acronym WIDIOM, WIDIOM, and what it stands for is, would I do it on me? And it's that simple. And I would say that to patients. I follow Widium. When I'm in Widium, I'm never in trouble because would I do it on me? And I like me. So people say, well, would you do it on your sister? Well, maybe they don't like their sister. So you never know what the dynamics are, right? But
Right.
Widium is very good.
I like that a lot. I'm going to start using that and teaching that actually. Because when it comes down to it, it's like I've used that with patients before. I'm like, if you were my family member, this is what I would be telling you to do.
Right.
Right. But now we can take that one step further. If this were me in the chair, this is what I would want as a patient. And this is what I would do to myself. So take that as you will. I love
Absolutely.
that. So where do you see AI fitting into a practice risk management, like workflow, actually?
Well, I'll give you an example. I mean, I just received a case where they're looking for an affidavit from me, and they're going to get it on behalf of the plaintiff on this particular case. The patient has paresthesia of the mandibular nerve,
Hmm.
and in the records, the dentist administered 8 carpules of septicane, which is articaine, which is implicated in nerve damage of the mandibular nerve. So I went on AI to Isaac just to double check things because I thought I knew what I know.
Yeah.
But what a great resource to access because he's gonna verify. So I said, what is the drug of choice when administering anesthesia for the mandibular nerve? And it said carbocaine and lidocaine. I said, is there any contraindications to utilizing articaine or septicaine? And it said, yes, it has been implicated in some cases to cause nerve damage. Well, why would I ever go down that road, right? So
Hmm.
now, I've seen that, I've learned it, it's verified, and it scoured the whole internet, all the literature sightings, all the reviews. How long would it take me? I want to date myself. When I went to residency, I had to go to the library to the index, the medical index, and pull a journal and copy the journal. Now you can do everything, of course, at PubMed, but that didn't exist then. So now we take from what I had to do to put together a presentation would take me maybe 60 hours to put together a 1 hour presentation.
Hmm.
then the students who followed me, who were able to get on to the internet when that came about, now maybe they spend 2 hours on a 60-minute presentation. With AI, is probably 40 minutes, 30 minutes. I mean, to verify. It's
Yeah.
amazing, just amazing.
So it's safe to say then that you think AI is going to help clinicians see their blind spots earlier, right? Because we do have them.
I will tell you this, from the other side of the coin. The answer to your question, the short answer is yes, of course, right? But attorneys are now utilizing an AI that has an algorithm where they input. They'll deliver an argument on camera, upload it to the AI, and the AI will explain the likelihood of settlement based on how they presented to the imaginary jury. And then
Wow.
they'll do 3 or 4 different closings, and AI will tell them, this closing you'll get 1.8 million, this closing you'll get 2.4 million, this closing you'll get.
Wow.
So, if you're not embracing AI, you have to understand that everyone around you is utilizing it. It's not going to replace us, but it's definitely going to make things very much more powerful if you use it appropriately, of course, right?
Yeah. So when it comes to like creating a trail, like a paper trail, how do you think AI is going to help do that for the patient and the provider? So both.
Well, basically, the chart note is absolutely critical in any malpractice event, right? Because the reason for the chart note is for defending one's action if they're questioned, right? But as a clinician, we all know that the chart notes function is also to give us information on previous visits to help with the continuity of care, of course, because we're not just doing it for malpractice mitigation. We're doing it because it's helpful and efficient for the treatment and management of the care of the patient.
Mhm.
But now AI is going to be able to take dictation and other data of what transpired during that particular visit and put it into a chart note that is very cohesive, very powerful to actually defend the dentist's actions. And that's going to make it so much better to mitigate malpractice. I will tell you that invariably, I have never to this day in hundreds of cases seen a chart that was appropriate for defense. It's just really puts the expert at such a disadvantage because the accusations are from the plaintiff. So it's the burden of defense is very heavy. And when the chart note says extracted number 19, and that's all you get, and it's terrible, how much anesthesia, why, what was the diagnosis, what was the rationale, did you give alternatives, is there informed consent? And
Mhm.
now, you get tired, right? The plates are spinning in the dental office. You're fielding phone calls, paying bills. If you own the practice, you're managing, micro meetings in the hallway about what's going on with the flow of the schedule. I mean, it is really busy. You're on that hamster wheel, and then you get to sit down and write the chart note, and all you just want to go home and you just write a quick note, and you're like, the chances are I'll never see that again. And that's when it happens, when you
Mhm.
say, oh, that'll never happen to me. Don't say that. So you want to be as thorough as possible. And if you don't write it, the old story is it never happened, right? So the chart note is that critical. And AI is really already in place now to help generate an amazing chart note all the time, every time. It's a system and it's effortless, really.
Mhm.
So how can you not embrace that as a standard of care, And
Right.
and everyone's standard of care is different. It is a subjective. There's no one exact definition, and it's always asked in deposition, what is the standard of care, in my opinion? And it's what a similar dentist would do on a similar patient in a similar community.
Mhm.
And that's a loose definition, but that's the best, generally speaking.
Right.
So what is the particular office standard of care? So I'd like to think my standard of care is way higher than just the minimum standard of care. And look, the audience on this type of podcast presentation, they're the top 1% of the top 1%. So, you know, th- everyone knows this already. I mean, they could tell you this, but they need to share this with their mediocre colleagues, the guys in the corporate, and they're running on a treadmill so fast.
Absolutely. I think I hear all the time, I feel like from clinicians, they're always saying, I'm just overwhelmed. There's too many charts, there's too many systems, there's too many decisions, there's too many solutions now too, right? It's like we have so many different solutions in so many different places. What's your opinion on that with how we're trying to approach and fix that pain point?
Oh yeah. The technology is moving at the speed of light. Different avenues for rendering
Mhm.
care, different techniques, all different ways to get to the finish line, different materials and all sorts of things and how to do it. Yeah, but listen, like any athlete will tell you, the amateurs practice to try to get it right, and the professionals practice to never get it wrong. And it's an attitude that needs to be embraced because it's so important to never get it wrong, right? Uh,
Absolutely.
they say it takes a lifetime to build a great reputation and a moment of stupidity to destroy it, right? And then you want to avoid that moment every moment of your life. It's basically.
So, how does mental fatigue contribute to malpractice risk?
Yeah, well, mental fatigue. Can you imagine an airplane pilot with mental fatigue? Can you imagine a batter in the batter's box with mental fatigue and that fastball coming a little bit inside? So, mental fatigue is real. We go through burnout. We go through ebbs and flows. Some mornings are tougher than others, and some afternoons also. So, when you have the AI, because this the topic, I mean, the AI never gets tired and never asks for a raise. It never gets sick. It never quits. It never transfers to another office.
Mhm.
It's there all the time, every time, and it's sharp as can be. So, what a great option to always lean on to get you back to sharp, right?
Yeah. So you would say that you've definitely seen examples where AI has reduced burnout by automating repetitive thinking or documentation, things that we're going to drop the ball at some point, right?
Right. I think it's going to alleviate burnout in the sense that it will reduce the mental fatigue to your point and to your question, because you're going to able to offload maybe some of the heavier decisions, even just for validation. Hey, I think I'm going to do this. Let me just double check, and then you get validation. Oh, okay. Now, you put yourself at ease. You're not going home wondering, hey, I was at the fork in the road. I wonder if I took the right turn, the correct path. So AI can help become your partner, if you will. It's always there. Why not? Why not use it?
Right, exactly. I feel like the biggest hurdle that we're facing right now is everyone thinks that it's going to dehumanize us or anything like that, but I truly honestly believe that it will not, as long as we stay in control of it, like you and I talked about in the last episode. But I feel like when it comes to malpractice specifically, what do you think could be verbiage or dialect that they could go through with AI to help teach them certain things to say or not to say to their patients in certain, like if you think about all of the malpractice cases that you've been on, what are some things where the clinician slipped?
Oh, yes. Every single case a clinician slipped. In some rare cases, it was intentional, where the subsequent treater disparaged the previous dentist,
Hmm.
um, knowingly or unknowingly. I've spoken to subsequent treaters, and I'm like, you threw this dentist under the bus. You know what the cascade of events now that is going on in the world of hurt that you put your colleague in, and they're like, oh my god, I didn't know that. Oh my god, I didn't mean that. I didn't know how to say, I didn't say it. So look, some people are a little better at verbal skills than others. Some people are more what we call confrontationally tolerant. Just because someone tells you to go to hell doesn't mean I have to go, right? So
Yeah.
I I feel that I'm a little bit confrontationally tolerant. So,
Mhm.
it's a function of maybe the environment you grew up in, or how you were trained and that kind of thing. But verbal skills are so critical because, it goes to that old saying, better to look stupid than open your mouth and prove it. um, why don't you take pause, slow down to go fast, think before you say anything,
Yeah.
and so here's a perfect verbal skill to give you an example. The doctor goes to a new course. He goes to a course or she goes to a course over the weekend, and we all do this. We're sitting in the course, and we get a revelation. Oh, there's a nugget of fact that we just came upon that we didn't look at, and I'm like, oh, that would apply to so and so's case.
Hmm.
I wish I could, change what I did. Well, you can. And here's the verbal skills. Call the patient. Hey, listen, I went to this really advanced course. I'm always taking continuing education to be the best I can. I want to put the best foot forward for you all the time, every time. I just want to look at and re-examine what we did. And I think I'm going to make some modifications. I can make it so much better for you.
Hmm.
I'm not going to get into fees and practice management, but let's say you don't charge, which I wouldn't, and you remedy whatever it is. You sleep better. You have a better heart because you did the right thing, right? And
Hmm.
and if you are verbal to point that out to your client, to your patient, guess what? That person will tell so many people. How much would you pay in advertising to have that person go around and speak your virtues, and
Hmm.
give them a couple business cards and ask them, would you mind referring, and tell your friends and family, this is how we do things here. You have to wear it. You have to speak from the heart. You have to just tell them. And
Yeah.
you're not saying, look, I messed up and I'm going to make it better. No, you just told them everything was honest. If you're honest, how could you go wrong? You just made an amazing ally who's gonna be a referral source like you never asked for. It's just incredible.
Yeah. Where do you think we get that mentality from that we can't be honest with our patients? We kind of have to be like closed-lipped. Like we
Yeah,
can't call and tell them, "Oh, there's a better technique and I want to redo what I did."
sure. Yeah, well, like in my office, if the crown, someone made an error with the date, it happens once in a great while. We had systems to help prevent it, but it can still happen. We're all human, and the crown isn't back, and the patient comes in. So maybe we do if the hygienist is available for a little bit, we can give them a little free cleaning, or we do something, maybe we'll send them a gift certificate for their inconvenience
Hmm.
to a restaurant so that they can bring, their spouse or somebody. And guess what they're talking about? Hey, we're here because my dentist, they had a glitch with the lab, but it's never the lab's fault. It's never anybody else's fault. It's always my fault. And
Yeah.
in my office, it's my fault. I don't care who did it. I say to the patient, it's 100% my fault. And you know what they say? Oh, don't worry about it. Don't worry about it. Like it's the end of the story. Like
Yeah.
now, the problem is when you start covering it up. When you start covering it up, now they're insulted. Oh, you think I'm that stupid? You're going to lie to me to my face? And now your ethics are compromised. And even though you're not really thinking you're lying, well, this happened. A winner has a plan, a loser makes excuses, right?
Hmm.
So, and it's true.
Yeah. I feel like it's a good way where we can segue into, can you explain to me what defensible documentation is and what it actually looks like to where it can help a clinician if something goes wrong?
Sure. I will tell you the flip side, and then I'll tell you the answer. So
Hmm.
I was in deposition, and I asked the attorney, where's the rabbit hole here? What is the opposing counsel? Where are they going to try to lead me into a box corner? And the attorney said nowhere. And it was a handwritten chart. It was a very, very obscure note. And my particular copy had been like copied 5 or 6 times. It was barely legible, and it's written in a doctor's handwriting on top of it. And I
Yeah.
didn't take that course. Like, I don't know how to read some of these these handwriting. So it said infection around implant. I could barely read it on my copy. And the attorney, the attorney deposing me asked, is it below the standard of care if no treatment was rendered for an infection around an implant? Because it didn't say referred, it didn't say recommended warm salt water rinse, it didn't prescribe an antibiotic, right?
So it
Just
didn't say anything.
It didn't say anything. So there's an example of a chart note, right? So the attorney closed the folder and said to me, is that below the standard of care, doctor? And I said, yes, it's below the standard. You have to give them what you have to give. I'm under oath. Doesn't matter who I'm helping, right?
I mean, your hands are tied at that point. What are you supposed to say? No.
100%, right. So then I debriefed the attorney afterwards, and I asked him, why you didn't tell me about this. And he said, oh, yeah, they asked about that chart note when they deposed the doctor, the defendant. I said, I never got that deposition. So then I called the doctor, which I'm not supposed to do. I said, listen, you got to sue this lawyer for malpractice. I was ill prepared. They didn't give me the deposition. I had no means.
Worse, I think what this really shows is that malpractice prevention isn't about fear. It's about awareness. It's about systems that protect both the patient and the provider. And it starts with communication, documentation, accountability, like you're saying, right?
Yes, everything you said is just a perfect summary.
Okay, great. So thank you for being a part of the show again, Dr. Feit. We are going to have a part 3, which I'm super excited about. We can get into more of the nitty gritty of it. This is Voices of Dental AI. We will see you next time.
Thank you.